We have new details on the timeline for approving shots for tens of millions of children and how those doses will eventually be rolled out across the country upon approval. It's an important but daunting task facing several logistical hurdles. In a moment, we'll talk about where things stand with the Surgeon General, Dr. Vivek Murthy. But first, NBC national correspondent Miguel Almaguer with that report. Miguel, good morning.
Savannah, good morning. The FDA's advisory panel is set to meet next week to discuss the safety and efficacy of a COVID vaccine for children 5 to 11 years old. Then as early as the first week of November, the CDC could give the green light, quickly allowing shots to go into arms, but distribution won't necessarily be easy.
If the FDA and CDC authorize Pfizer's COVID vaccine for children 5 to 11 years old, some 28 million kids nationwide would immediately qualify. But the logistical rollout won't be easy. So this morning, the White House now unveiling its multi-pronged plan to quickly protect one of the most vulnerable populations.
Everybody come back to the rug.
Using trusted sites like schools and community centers, many families will have easy access to the free vaccine. A smaller dose than the one taken by adults and given at most pharmacies, the White House says it'll pre-package easy-to-distribute vials so supply can easily meet sudden demand.
Well, children, certainly less than 18, account for about 20% of the population, so children are important to create herd immunity.
The two-dose regimen, given 3 weeks apart, could be fast-tracked with the help of over 25,000 doctors' offices, 100-plus hospitals, and tens of thousands of pharmacies nationwide, all standing by at the ready. Targeting rural communities as well as big cities, the White House will need help from local jurisdictions, including an army of vaccinators, and it comes at a critical time.
We know that when the virus first came into the United States, children accounted for less than 3% of cases. Now they account for 27% of cases. We'll have 200,000 cases of disease in children a week, or 250,000 cases a week.
Just as cold weather states brace for a rise in COVID cases because more Americans are gathering and spreading the virus indoors, vaccination mandates still face protest. And now one high-profile reversal, Southwest scrapping its plan to put unvaccinated employees on paid leave as a federal deadline in December looms. Even as the most vulnerable wait to get vaccinated, many are pushing back. Some parents are among the groups saying they won't inoculate. This morning, the push to protect and the fight against it.
To encourage parents of younger children to vaccinate, the White House is pointing out that millions of 12 to 17-year-olds have been fully vaccinated safely. They say those inoculated are 10 times less likely to be hospitalized.